everybody. I have a topic today to talk to you about that is explaining the inexplicable. How can we try to understand something that we cannot explain? What is our approach? My approach that I'm proposing is, my assumption is, can we explain something that we cannot explain or understand it by changing our perspective on it? I want to talk in a sense of our modern world medicine that I work in. I work in the medical system as a dentist. And inexplicable cases that we have there, what is it that we cannot explain very often is, for example, the chronic diseases. We have very little ways of explaining how the chronic diseases work yet in our modern medicine. And yet we have a very rapidly increasing number of patients with cases that cannot be explained. In my example, tooth pain, toothache, without bacterial infection, but still the tooth hurts. But you cannot explain it by X-ray, you cannot explain it by your physical approach. And very similar are a lot of other aspects of medicine, not only our dental sector, but a lot of sectors of our clinical system. We have an increasing number of patients with illnesses that cannot be explained. We call them idiopathic diseases. Idiopathic comes from Greek. Idio means your own or my own. Pathos means a suffering or a disease. So it's a disease of its own. This is what Wikipedia says. A disease of its own that cannot be explained by medical terms. So why do we have this increasing number of these not to be explained illnesses? And how can we explain them is my point. Now, what I want to assume is that maybe if we changed our point of view, our angle that we view these diseases from, maybe if we widen our angles, we bring into consideration other aspects that we are not familiar with in our Western modern culture society, but that other societies have. We have very many traditional medicines in other societies, or traditional ways of approaching humankind in general that other cultures succeed with. Do you know these so-called blue zones, I think they call them, where they have a lot of, or accumulation of people that live very long, that live longer than we do in our modern Western culture? Maybe if we bring into consideration that other cultures, they have aspects of life that we don't consider ourselves, but that could be worth exploring. If we considered that other cultures have traditional medical ways of treating patients, or traditional ways of viewing the world, traditional sciences that we do not include in our regular everyday life, I would say, in our university, school systems, in our medical clinical systems, but that could be very helpful for us if we just considered other viewpoints on, for example, medicine, other viewpoints on societies, on how to interact with people, on how to teach people at school. So, for example, these sciences can be shamanism, ancient sciences that are based on experiences, or astrology, or Ayurveda. I think Ayurveda is the oldest medical tradition that is over thousands of years old. Traditional Chinese medicine. What if we opened our minds up to the possibility that those cultures, those sciences, that they can add something to our own culture, that they can add to our own knowing and viewing of the world as we learn it in school, as we learn in university? What if those sciences, they can be helpful, they can be included in our treating patients, in our learning at university, in our learning and understanding about ourselves as human beings? What makes a human being? Is that just our physical body? This is what our traditional university studies, considering, for example, medicine, this is what we focus on. And it's not wrong to focus on that. It's good because we are very developed in that sector. We have very high developed technologies. For example, in my field where I work, I'm grateful that we have such developed technologies and such knowledge of the physical realms of the physical body, that we know how to treat a physical thing very well and very advanced. But if we included in our viewpoints aspects such as energy medicine, if we included in our teaching children about how valuable their own emotions are for their well-being, how valuable their everyday behavior and their society structures, how valuable and how much of an impact your day-to-day social interactions, your day-to-day social relations and relationships, how your relationships to your parents, to your family, or your friends or your colleagues at work, how that shapes your physical body, because it shapes your nervous system. How much of an impact has your birth, for example, the way that you were born into this world, and then the way that you were brought up, your ways of thinking, ways of speaking to one another, your wounds that you develop, that you encounter as a child. There is something such as the original wound. We have this in astrology, for example. Astrology talks a lot about original wounds in yourself, how you can manage to heal, and through the healing of your wound and through realizing how much of an impact your inner wounds and your inner being has on your day-to-day life, your reactions to the world have a lot to do on how you were brought up, for example, or how you perceived the world as a child, when your unconscious was heightened much more than in your adult life. The science that speaks about or that analyzes how much of our conscious and how much of our unconscious mind do we perceive every day? The amount of conscious thinking is very, very little compared to the amount of unconscious ways of reacting, unconscious ways of acting, unconscious ways of living. There are definitely more decisions that we make from unconscious reactions, from our unconscious point of view, than decisions that we make consciously. So as children, when we perceive the world with more feeling, more intuitive, and more from our unconscious, we take in events, we take in feelings, things that happen to us, and maybe we don't remember them consciously today, but they impact how we react and how we act day-to-day basis, and how we act day-to-day in our everyday lives. So a lot of things, I think, should be considered when we treat patients, should be considered as doctors, but also should be considered as from the viewpoint of the patient. How do I consider myself? How do I view myself? I think it's important to think that who is responsible for my well-being? Is it the doctor, or am I responsible? Who is responsible for how I am feeling? Is it other people, or is it myself? How can I create this life where I am reflecting of my own behavior, where I'm reflecting of my wounds, where I'm reflecting of how my inner world affects how I live in the outer world, how my own feelings, maybe repressed feelings, they still impact me on how I live my life. And who do I want to hold responsible for these feelings, or who do I want to hold responsible for the way that I live my life today? Do I want to be responsible myself, or do I want to hold anyone else responsible? But then I am no longer in power to manage and to create my own life if I hold anybody else responsible for how I live my life than myself. But if all this is unconscious, if I don't think about this at all in my life, then maybe I don't have the chance to change my viewpoint. I think it would be very, very important for us as individuals to start thinking about what responsibility do we carry in this world, because the way that I act has an energetic influence on everybody that surrounds me, but on everybody on the planet, which is very broad, of course, but it's true, because the way that my energy evolves, the way that my energy is, everybody who comes in contact with it is affected by it. And if I start to learn to control my own energy, if I start to learn to control my own diseases, or at least how I view my diseases, do I want to take responsibility for everything that happens to me? If I take responsibility, of course, I also take power, because it's an empowerment to say that I myself am responsible for how I live my life, for what happens to me. And so I have the responsibility, but also I have the power to change my life then. I have the power to create the life that I want for myself. If I start to look at what am I responsible for? My reactions, my words, am I responsible for them? And how are my inner, unconscious parts of me, how are the patterns that I formed maybe as a child, how are they triggering me maybe to react in a way that I don't consciously, that I don't want to react like, but I still react because if something unconscious is triggered and something comes out in me and I react without even knowing what's happening to me, then I'm not in power of my life. But I can take power by starting, I think, to look at myself first, to look at my patterns, my behavior, my emotions, my feelings, to start considering that there is more to me, there is more to the world than I can see with my physical eye. There is an energetic component to me, a soulful component. There are a lot of things that we can speak about, that we can learn about ourselves first, to know why we react the way that we do, but only if we look at ourselves, if we are honest with ourselves and reflective, and if we look at what is my own pattern, what do I bring to the world, only then we can take responsibility for it, but only then we can change it as well. So it's an empowerment to take responsibility. And it's a change of viewpoint, because university doesn't teach this yet to students. The schools, they don't, at least my school, they didn't teach that. Or even our society and my family, they didn't teach it because we didn't really learn about these kinds of things in our society, in our generations. But I think this is changing now. We have a change in viewpoint. I think we have a change in energy right now here in the world. We were shaken up by the last few years, and we are still shaken up, or it's shaking up because events are happening in the world. But we have to ask ourselves, what is our contribution to these events? What is our energetic contribution? Because if I'm angry myself, if I'm angry a lot, how do I expect the world to be kind to me when I'm angry? We have to start in ourselves. The smallest part of the puzzle is ourselves. But if a lot of puzzles start improving themselves, only then we can change the whole puzzle. It starts with ourselves, I think. It's very important to acknowledge the possibility that there is more to this world. There's more to us as human beings, or more than we can see with our physical body, that we can perceive with our physical body. There is more. And it has a great impact on our well-being, on our health, on our diseases, on our relationships, on how we live our lives. It's important to start looking at those things that we maybe cannot perceive yet, but if we start opening our minds up, opening our perspective, just things that other cultures already know about. The shamans, they know about the energies, how important connection to Mother Earth, how important our connection to the just higher spirits and higher realms is, because this is where we come from. How important our connections with each other, and how important that we learn about these things, because these may be the pieces that we are not considering. This is maybe what our modern world is lacking, is the understanding of the not physical realms, the understanding of the energetical, how what we cannot see impacts us still, how it has an impact, how what we cannot see but maybe feel impacts our physical bodies. Maybe this is the piece that we are missing in our medicine, why we cannot explain all those chronic diseases. Maybe because we have to widen our perspective. Maybe because we're just looking at one simple thing, and by this one thing that we hold so important, we're forgetting, maybe we're not seeing all these other sciences that we can be using, so much wisdom that we can be using, taking from other cultures, from our own culture, that we are just not developing right now at the moment. Okay. Maybe this sets something in you in motion to think about what is it that you could be considering in your own life. What is it that you want to know more about? What is it that you could read or learn about that could help you understand your own life better, and the meaning of your own life, and the meaning of your physical disease, for example. Because there is a lot of wisdom in these old traditional cultures that we can learn from, that we can take to use to improve our systems, to improve our medical systems. Thank you so much for listening. I wish you all the love in the world, and I wish you to be well and to always keep an open mind, to keep learning about the thing that interests you, because everyone has a different part to play in this whole puzzle, I think. And if we follow our intuition towards that interests us the most, that brings us joy as well, then we can play our part well and contribute something that is for the greater good, the good of all. Yes, be well, and goodbye.